How would you have that conversation with someone who's so resistant to getting a hearing device?
That they literally don't know what they're missing.
Yeah.
That's so true.
Hearing loss is so gradual. It declines over a very long period of time. So the way you hear has just been your normal way of hearing. A lot of people don't realize how much they're missing out on until they get it back. So I'm always saying, try it. Just try it. And then you see the differences for yourself. You don't know what you don't know.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts.
You know, as we get older, there are going to be certain changes that we all experience, Selah. And I feel like one of the things that I'm anticipating, not in a good way, is hearing loss, right?
Right. And that's what we're talking about today, hearing, health, and dementia.
There's a connection between the two?
I think there is.
Yeah, but I didn't know that.
Yeah, it makes sense because if you can't hear, you cannot engage in social conversations, which does seem like it would lead to dementia.
And it could also be really isolating if you can't connect with other people, if you can't hear what they're saying, and if you can't contribute to the conversation.
You retreat.
Yeah, and you feel left out.
Yeah.
And isolation is not good, especially as we get older. That's just not good.
No, and especially for dementia too. That
real,
that correlation makes sense for
But I want to know like what kind of studies have been done on that because I hadn't really heard that before. That's intriguing.
Yeah, it's very intriguing. I'm curious too. And when does that start? Like what age is this typical?
And what preventative measures can we be taking now if there are any? And then also, we're the parents of young kids.
Yeah.
Are there certain things that we should be doing now that could be preventative for them or helpful long term to maybe just kind of set some good practices in place now? I know when I have my son in front of his tablet, which yes, he's in front of his tablet sometimes. I say, can you just put your headphones on, please, so that I don't have to hear that and the television and it's all the ands, you know? And I think that that's a good thing to have.
But it's like, are the headphones too loud on his ears? I know.
And how do I know if
what
they're
is safe
too loud?
listening?
Like, what is safe listening? Right, because I don't want him to cause any damage now, right?
Yeah.
I want him to have good hearing health
Yeah.
overall, right?
I mean, I take my kids to rock concerts. I'm just kidding. But I have taken them to loud events and I put those little noise canceling things.
Same.
Yeah.
Exactly.
So
and he wanted to go to a monster truck event and I was like, what? I'm like, I don't know, buddy. But then I said, if you have the proper hearing protection, then maybe.
Then let's do it. Yeah.
Yeah,
Well,
for
let's talk to our expert today, Dr. Dana Coveney.
Oh, yeah. Dr. Dana Coveney serves as the Clinical Director of Audiology and Hearing Aids of the Palm Beaches.
Yes, she's skilled in diagnosing and treating hearing loss and tinnitus, which results in better living through better hearing.
That makes sense. She is also a fellow of the American Academy of Audiology.
And a member of the Academy of Doctors of Audiology.
And in 2019, she was voted by the community as Best Audiologist and Best Hearing Aid Center in Palm Beach County.
She's the best.
She's doing something right.
Yeah.
Right.
She's the best.
Oh, I love that. I want to hear more, though, about this connection, the correlation between overall hearing health and dementia. How do those two connect?
Well, let's find out.
I know she'll have the answer. Let's bring her in. Dr. Dana Coveney. Come on in here. Let's chat.
Yes.
Oh, Dr. Dana Coveney is here joining us to talk about our ears and just listening. And also, we're going to talk a little bit about dementia today.
This is a very important episode.
It really is.
You or your loved ones, the elderly people in your life in particular.
And anybody who has ears and wants to hear really well. We're so glad to have you. Welcome.
Yes.
Thank you for having me.
Yeah, so tell us how you started in audiology. It's such a specific field.
It is, yeah. So I got my bachelor's degree in audiology and speech pathology.
Wow.
Then I went on to get my doctorate in audiology.
Okay.
And I went right into private practice right out of school.
So cool. By the way, do most audiologists also study speech pathology?
It's a field in undergrad where they're kind of combined.
They are,
in more of a communication disorders. And then you pick kind of what field you take to.
What area you want to specialize in. That's so neat.
Was there something earlier in life that inspired you to want to choose this direction or this specific field?
I just really was interested in all of the aspects of patient care and being a doctor and working face to face with people, and then all the technology pieces where you use computers and devices to match that to a patient.
It's sort of like science and tech meeting medicine and tech meeting together.
Exactly.
Yeah. That's so cool. And we have heard eyes are the window to the soul, but I think ears are the window to the brain. Is that
Absolutely.
something you would confirm? I like my theory.
I do too.
Yeah. I think especially with older people, I know I personally have experience with a lot of older people. When I was a personal trainer, I worked with a lot of older patients. And I found that when they got their hearing device, everything just came to life, whether they're in their 70s, 80s, 90s. What do you think about that?
Absolutely. Hearing helps you stay engaged with people, and engagement is so important. Being able to socialize and communicate and connect with people. And that's what your hearing gives you.
What are some of the reasons for hearing decline in older adults?
There are many reasons
Yeah.
for hearing decline, but it's a deterioration. The inner ear starts to weaken, and those connections, those pathways from the ear to the brain start to weaken as well.
Which is why I know I've read studies that it can lead to dementia. Is that true?
Yes, there's been many studies done now that shows untreated hearing loss can make it more likely to develop dementia. And depending on how severe or significant that hearing loss remains, can even double or triple the likeliness of dementia, not including other health factors, cardiovascular issues, things like that.
Why are they connecting the two? Because this is my first time hearing of that. What's the connection between dementia and hearing loss?
So we hear with the brain. We don't hear with the ears. Ears collect the sound, and the brain has to process it and make sense of it and turn it into speech. And that pathway needs exercise. So think of the ears like muscles for the brain. Keeping your ears healthy and active and your hearing active helps to keep your brain active. And they did long-term studies, 25-year studies, that showed physical changes when they did imaging of the brain, that the brain was atrophying or shrinking at a faster rate with even a mild hearing impairment.
Yeah. I know for me, I saw one of my grandfathers just sort of shrink, right? And become almost a shell of himself. He refused to get hearing devices. And it was so sad. And I really, truly believed if he would have been able to hear, he could have been part of the family events and part of society again. And do you see that a lot with elderly?
We see them start to withdraw from things they like to do, places they like to go, because they get embarrassed that they're not able to follow along with the conversation. They start to get anxious that they are missing something, or they won't hear the phone ring or the doorbell ring. And it causes a lot of quality of life issues for that person.
How would you have that conversation with someone who's so resistant to getting a hearing device?
That they literally don't know what they're missing.
Yeah.
That's so true.
Hearing loss is so gradual. It declines over a very long period of time. So the way you hear has just been your normal way of hearing. A lot of people don't realize how much they're missing out on until they get it back. So I'm always saying, try it. Just try it. And then you see the differences for yourself. You don't know what you don't know.
That's so true.
Why do you think there is so much reluctance as we get older to not just deep dive into the best ways to continue living? I don't understand that.
Exactly. Now with this whole healthy living and healthy aging.
And wholeness and wellness.
Hearing is a huge part of that. For
sure.
cognition, for your memory, for your attention. Hearing helps with all of that. And there's nothing bad about hearing aids. There really is no downside. But there was such a stigma, I think, against hearing aids, especially in the past, that they didn't work very well.
They either didn't work or they would embarrass someone because of that loud. Remember the beeping or the
Or how large
the
they
ring.
were. Yeah.
The size. But now everyone is wearing things in their ears.
Exactly.
There's people wearing big white buds sticking out of their ear.
That's true.
So true.
And we have so many cosmetic options for hearing treatment now that patients should not wait so long to at least get tested. And if they are feeling like they're having trouble remembering things or engaging, then making hearing testing part of that battery, and we try to educate, primary care physicians and people who are on that front line with that patient that, well, maybe if they think they're developing dementia, that they should get a hearing test as part of that battery as well.
Are you seeing a direct connection between hearing loss and someone's cognitive recognition, their memory, and all of that?
Absolutely.
Really? How so?
Well, it can lead to more cognitive decline at a faster rate if the hearing loss is not treated.
That makes sense.
On average, how long are you thinking people are waiting before they're coming to see you?
About 5 to 7 years.
Oh, wow.
When they start to experience issues to when they're actually coming in for help. Or they might have gotten tested 7 years ago, decided not to seek treatment then, and then, I'll do it when it gets worse, or,
Right. Is it because of cost? Is it because of embarrassment, or all of the above?
Probably all of the
Right,
above.
a little bit of
Some people get dragged in kicking and screaming from their loved one who can't take it anymore, who are so frustrated with their home situation and having to repeat themselves that the patient just doesn't want to be there.
Yes.
How have you seen in those specific cases when someone is brought in kicking and screaming and then they meet you and you're so warm and approachable and you're able to give them something that changes their quality of life? What is that experience like?
The number one thing I hear all the time is, I should have done this sooner. From every patient.
I believe it 100%.
Definitely. Wow. Giving someone the gift of hearing must be so rewarding for you.
It really is.
It's amazing.
You see the difference in their, in their engagement and their quality of life and in their family life. And everyone's just so grateful and thankful, but it's taking that initial step.
Exactly.
We're trying to get the word out to...
Yes, that everybody needs this. What are some of the different types of hearing devices that you could introduce our audience to?
So hearing devices are discrete. They're computerized, so they're little mini computers. They're really easy to use now. They're really self-automated in that they're going to analyze the daily environment, and as you change environments, the hearing aid's going to adapt itself to enhance for speech and communication. Yeah.
So like if you go from a crowded restaurant to your house.
Yep.
Or your car.
Or your car.
And everywhere in between.
Yeah.
The
That's
hearing aid's going to adjust to find the speech signal. Who's talking, where are they talking from, and how do I enhance it for the person?
Oh, what about really active older adults? I know, like, my parents are really active and, like, go swimming and all of that. Are there ones that are, like, waterproof, or do you have to take them out when you get in the water?
Yeah, you take them out to sleep, shower, swim.
Okay.
Those are my 3 S's where you don't wear your devices. But other than that, they do have weatherproofing. So we can't call them waterproof, but they are pretty moisture protectant inside and out.
It's raining or something.
Exactly.
Yeah.
Don't worry too much. Okay.
Think of it like your cell phone. If it rains, you get a little water on it, you wipe it down, it's typically fine.
You just don't want to swim laps with it.
Correct.
You get swim laps.
I've done that, by the way.
Oh,
Good
my
idea.
goodness. Oh, my goodness. Speaking of, should we be wearing, like, special, I don't know, like earplugs or anything like that when we're swimming or to protect our ears?
No, typically water is fine.
Okay.
Yeah.
Okay, good
Okay.
to know. Do you find that the latest advancements of technology are more helpful for these older clientele, or is it turning them off even more? Do you know what I mean? Like, is it making it more?
It's both.
Okay,
Yeah.
okay.
So how I put it to the patient so that they understand it is the hearing aid is doing a lot for you. So you wear them, forget that they're there, and let the technology inside the device work for you. Where we used to have them tell the hearing aid what to do. Now the hearing aid knows what to do in different situations and can adjust for them. So put them in, forget about them, and let them work.
It's smart. It's a smart device.
Very
Smart
smart.
device, living your life. It's really great. And the more that an older person I know can be engaged with their family and friends, the more young they seem.
Absolutely.
Yeah.
Gives them back some years.
Yeah, what sounds older? Having to say what all the time, or
Yes.
being able to hear and having a little tiny hearing aid in your ear.
That's right. That nobody knows. It's not like a big horn like it used to be.
I don't think people are as aware of all these advancements in technology, because when you first think hearing aid, first you think, oh, that's for old people. Okay. Or you think, oh, it's going to be a very noticeable device where people are going to say, even if I don't look old, they're going to think I'm old, right?
Yeah.
But you're saying you can make customizable ones that are undetectable?
Absolutely. Completely
That's
invisible.
amazing.
Custom molded, custom made for the person's ears.
That's so cool. How important is it to raise awareness about hearing health and cognitive function and all of that stuff with the public health?
It's so important for public health to be aware that, again, hearing loss is one of the most common issues, and it's very treatable. And it's one of those things that they're starting to do studies now where they're showing the effects of hearing treatment on cognition, memory, and attention, that they are showing improvements.
That's so great.
When treated.
What steps can we take at any age to protect our hearing?
Just to preserve the hearing if you're in any dangerously loud environment. That's the only preventable form of hearing loss that we have. So wearing hearing protection if you're doing any kind of lawn care, wearing hearing protection if you're at a sporting event or a live music concert or venue, even kids in the band, at school in a small music room should be wearing hearing protection.
Oh, interesting.
When you wear earplugs, people think, oh, I can't hear anything. Well, that's simply not true. Oh. You can have conversations, you can talk normally and hear a normal volume. It just brings the overall volume level down to safer listening.
I see. So all of these hearing devices, how costly can they be?
So there are thousands of hearing devices on the market today. What we do during the consultation process is really dial into the person, their listening needs, their daily activities, and then we customize a treatment plan specifically for them. Are they sedentary and mostly live in a quiet situation? Or are they working and in and out of meetings, in and out of restaurants on a daily basis that the technology has to keep up with them? And so the price points and the treatment plans vary by the person and what their specific needs would be.
So it could be like as few as a few $100s up to like thousands of dollars.
Exactly.
It can get pretty expensive.
Wow.
Do y'all offer any kinds of like financing for that?
Yes, we do offer financing at my office.
Oh, that's good. That makes it way more accessible for people.
Do you take the CareCredit credit card?
We do take
Oh,
CareCredit
great.
at my office, yes.
That's great.
Makes it a great option.
Yeah, much more accessible.
How often should we be getting our ears checked? Like I'm in my early 40s. Right now, I don't feel like I've experienced any hearing loss, but I know as I age, things change. How often should I be getting my hearing tested?
I mean, you get your eyes checked every year, right? You get your physical every year. You get your dental cleanings. Why not
ears
make
checked.
hearing health part of that overall health and wellness checkup battery?
Yeah, that's such a great idea.
That is such a good idea.
Yeah,
I don't know why I don't think about it.
that.
You know what? Because I think a lot of times people are like, I'll deal with it when it becomes a problem.
That's
Exactly.
right. Yeah.
But why wait until it gets to be that problem if I can take preventative measures right now?
Is it part of a regular physical?
Some doctors have little screeners, that test a couple beeps, but it's not a full diagnostic that an audiologist would do. But typically, it's something we recommend annually, or if you start to feel like you're having a little bit of difficulty.
Well, especially older people.
But the
they should be
sooner
checked.
you get treatment, if we get it early, the better outcomes we have.
That's
the
true.
younger the brain, the better the hearing, the better the outcomes. Instead of waiting until it gets significant, where it takes a lot more work to treat it.
Can you reverse it? Like once someone starts getting their ears fixed with a hearing device, can their dementia get a little bit reversed?
So they're starting to do some of those longer term studies.
Okay.
And what's come out so far is that those who are at higher risk for dementia, so they also had like cardiovascular issues, which leads to higher risk of dementia, showed an improvement in their memory.
Oh, that is
makes sense.
substantial.
Yeah.
So not direct correlation, but what's coming out is showing that hearing aids are really good for brain health
Wow.
and memory and cognition.
Exactly.
Keeping that stimulation.
Is there anything we didn't ask you related to hearing loss and how it impacts a patient's life and the correlation with dementia?
We just don't want patients to wait till they're so isolated and so withdrawn to do something about a hearing issue, because it is so treatable. And the treatments are so readily available. And hearing aids we see such an improvement when we treat the hearing loss
Yeah.
that there's really no reason not to.
Why wait?
Why wait?
Yeah.
No, absolutely.
So we have this segment. It's called Ask the Expert. These are
Yes.
questions that come in from members of our audience anonymously. I'll start this time.
Okay,
This person says, I'm 34 and have never had my hearing checked. Oof. What is the right age to start getting it checked?
Oh, that's a good question. I would say 50 or now if you're feeling like you're having issues.
Well, like we were saying, it could be part of an annual exam.
Exactly.
Yeah. Ask for it. Why not?
Ask for it. Yeah, absolutely. Okay. This person says, my kids have their earbuds in all day. Should I be worried about their hearing health? Are there any short-term or long-term issues with earbuds?
Yeah, that's a big issue now.
Mm-hmm.
It depends on the volume of those earbuds. It depends on how loud they're listening through those earbuds and for how many hours a day. So once we get to a certain level of volume, it can do some permanent damage.
Oof.
But if they stay below that threshold, it can't.
Are you seeing younger and younger patients because of that? This is just my question.
Absolutely.
Oh, no.
Okay.
We're having to go educate in like kindergartens about safe listening now, because by the time they get to high school, they're showing evidence of permanent hearing loss in teenagers because of the accessibility to the music and wearing those AirPods or wearing those earbuds all day.
Gosh.
So sad.
So do you think it's better to do an over-the-ear listening device or an inner-ear listening device? I mean, because I guess it would always depend on the volume, but is it better for the younger kids to do over?
It really, it doesn't matter. It just has to do with the level of volume and how many hours they're listening at that volume.
And same for us, obviously, not just
Absolutely.
kids.
Any age.
You can go to open air concerts, and those speakers could be dangerously loud for your ears without protection.
So it's all about protection.
I feel like this is a question that I would have asked anyway, but I'm so glad that one of our audience members asked this. What is the best way to open up a conversation with my aging parents about addressing their hearing loss?
That is a great question.
Yeah.
I would just put it as, let's get you a baseline exam. It's been recommended for overall health to see what your levels are.
Yeah.
Let's just see what your levels are.
And let me go with you and let me get tested also. Because I want to get my baseline.
That's a good idea.
That is a good idea. So then they don't feel alone, and they're also getting the witness you do it. Plus, you mentioned it's painless.
Yeah, it can be a very difficult conversation. I definitely,
For sure.
And to convince someone of something they really need, but maybe don't want. So thank you for that.
What does a typical exam, a baseline exam, entail?
So we do an interview process where we talk to the patient about all of their medical history factors, things that might lead to hearing problems. Then we do a physical exam inside the ear canals, check for earwax, check for infection or blockage or anything physical anomalies. Then we do a diagnostic hearing test in a soundproof booth.
Okay.
Where we check the levels of where they can hear, if it's normal hearing at certain levels or if they're outside of those thresholds for normal. We go over the test results to show them where their deficits are at that same appointment. And then we go over treatment options, only if necessary.
Okay. Wow.
I have some more questions. You want to ask one?
Oh, sure. Are there any factors that contribute to cost of hearing aids?
So there are features in hearing aids that, as those features get more advanced, the cost of those devices can go up.
Okay, this person says that dementia runs in my family. Can I help slow down the process with hearing treatments?
Absolutely. If hearing loss is something you experience, then hearing treatment can help with, again, keeping your attention, memory, hearing active. And engaged. Engagement is so important.
That's the main thing, yeah.
My kid gets hearing ear exams at school. Is that enough?
So now we have testing at birth where before that baby leaves the hospital, they're going to get a hearing exam.
Oh, yeah. I remember that with my last one.
What does that look like? I wasn't in the room when they did it, but what does that look like?
They're testing brain waves. So that pathway from the ear to the brain to see if those pathways are coming in. So we can actually measure hearing that way in babies. And if they pass, typically a school-age child is not going to develop kind of a hearing issue unless it's infection or medical based.
Oh, got it.
So it's usually either born with or something that develops kind of later in life unless there's a medical issue.
Okay, but they'll still do the hearing.
They still do those hearing screenings at
interesting.
school.
With the ones with the beeps?
Yeah.
I remember those. Yeah. Yeah, exactly. Oh, man. And you think those are necessary still, even though
I do.
Yeah,
Just to
okay.
catch anything.
if there's an infection.
Or a
anomaly.
blockage or anomaly. Exactly.
Okay, cool. That's really great. Wow.
Dr. Dana Coveney,
Thank
we are so glad you
you.
came here and explained all this to us.
Thank you
Thank
so
you so much for having me.
Great having you.
Yes.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.